if we took pulse in our 18-year-old footballer, we'd take the posterior tibial pulse and we'd probably find that that was normal. And we'd take the dorsalis pedis pulse and we'd probably find that that was normal. So it's not vascular, is it? I'm off. Have I done enough? So this is normal, it's the same as the other side. It's not, it can't be vascular because the pulses are fine.
Well, would it make any difference whether you have the symptoms at the moment or not?
It would. So how do we get the symptoms on? Of course, yeah, so this is all logical, isn't it? This is not rocket science. So I've not done my job properly. I've taken the pulses and I thought it was okay, but it's actually, I've not done my job properly. He needs to do some exercise, she needs to do some exercise, okay? So what sort of exercise shall we make her do? You can stay female for this one. Yeah, what sort of exercise shall we do? So what did I say? Running around on toes, running around on toes, changing direction.
Well, that's what
Something on toes, all right? So we could get the patient to maybe jump up and down a hop or something, and we do it on one side and then the other, yeah, okay? So I'll tell you what the findings were. If we did an exercise test, so at rest, I take the pulse here, I can find it feels normal. I take the pulse here, I can find it feels normal. I do the same on the other side, exactly the same, all right? So we exercise the patient. Let's, for one reason or another, say we decided to do a hop test, so we're doing it one at a time. Hop test on the right, asymptomatic leg, no symptoms. Put them back on the table, take the pulses. What would I expect to find with the pulses? The pulses are now bounding, yeah, easy to find, brilliant. So this leg's fine, okay? Cash back, this is the one with the symptoms. Same story, hops for the same length of time until the symptoms come on though now. We want the symptoms on. Are they as bad as they come on when you're playing your football? Yes. Okay. Back onto the table. Palpate. Oh. Can barely find these pulses here now this time. Okay, so we've gone from a normal leg with bounding pulses following exercise, which is normal, to another one now, which is the pulses are almost diminished. Okay, something ain't right here. With just that information, you could probably refer the patient on to the GP with the suggestion that something was happening somewhere along the line of the blood flow here, and it's because the symptoms are distal to the knee. It's very likely that it would be more in this zone than it would any higher up. Okay. If you wanted to get really flashy and do something really fancy, you could use one of these things. Now I'll just show you this, just an illustration. Handheld Doppler ultrasound. So if you had one in your clinic, and all good physiotherapists have them in their clinics, I'm only joking. No. It's a specialist thing, it's a sports medicine thing. You don't really need one of these, but it's nice for you to just see what this is like, so that you know what it would be like to refer somebody on. Yeah, it's a girl. Yeah, okay. Nice, healthy blood vessel. 1, 2, 3. That's the sound of it. Nice elastic vessel. If this was a diabetic vessel, you just get whoosh, whoosh. You know, so this is a healthy, elastic vessel. Triphasic is the sound that you're hearing there. We've lost one there. Don't worry, we'll be fine. Okay, what you can also do is do positional tests. So if we do a positional test, get you into full extension there. It's not really changed very much in this case, okay? It's funny, what I'm going to do is ask you to push it. No, just listen. Right, now push. Push. Relax. Push. Relax. Push. Relax. We've got one. Relax. Don't worry, you'll be safe. No. It's normal for some individuals in certain positions to actually just, so the same way as Roger's going to talk to you about this in a minute, the same way that it's normal for someone to switch off this vessel when they turn this way, absolutely normal, it's not a problem. Some people can switch off a vessel by going into plantar flexion or dorsiflexion, and you're one of them. But it's of no consequences. It might be if you're a ballet, you're not a ballet dancer, sorry. It might be if you were a ballet dancer or spending a lot of time up in these positions, because that ballet dancer will start to say, well, actually, when I'm up on my toes a lot, my lower limb feels really weird, and I've got tingling in my toes, probably. Yeah. Okay. But for someone who doesn't do that, it's no consequence. It's just the normal artifact of anatomy. Okay? So the same way as I might switch this off. So if you put this Doppler on my neck here, this would probably switch off, as it would with many other people in the room. And I'll probably find, if I went through you all, I'll probably find 3 or 4 that did the same thing here.
Would it make any difference to your evaluation if it disappeared on the left side but was normal on the right?
Yes, of course. What you do is do the comparison, of course. So you can't just go on this one test. You have to go on the clinical picture, the comparison of left to right. You might want to take a blood pressure at the ankle after exercise. So it's only if all the things are gradually stacking up.
So in your experience, the anomalies from right to left would not be big enough to cause a different response from the two sides?
Could do. Could do. To be honest, what we're finding is that kind of anything can happen in this spectrum. So we see some people who've got bilateral external iliac artery endofibrosis, some have got it really badly in the left one and just a little bit in the right. You know, or they've just got left-sided and the right appears to be normal. So to be honest, you can get any end of the spectrum, to be fair with this. We're learning kind of about this all the time. But so if that was fit in a clinical picture and we'd found this on this side and not on this side, and we'd taken, either through pulse palpation or using one of these or an exercise test, it doesn't matter. One way or another, we found enough to send the patient off to the GP. They'd go off to the GP and have some tests done, and then, the other differential diagnosis, of course, was what's it called? Compartment syndrome. It could have been compartment syndrome, but to be honest, these tests would indicate that it probably wasn't, because it looks like it's an arterial flow problem. Yeah, that sort of thing. All right. Roger's going to move on now and take that to another stage further forward. Thanks for being a model.